Hello, everyone. Good afternoon. Welcome to our webinar. We are very happy to have you all here. And we are so many participants from many different countries. And this makes us really happy. I'm going to introduce first of all myself. My name is María Catalayud, and I am a Spanish physiotherapist specialized in horses. I work as a clinician, and I also do research with my very best friend María and colleague. We both investigate together in equine myofascial pain. And we are also the instructors of the Equine Dry Needling courses at Myopain Seminars. So, María?
Hello, good afternoon, everyone. We are very happy to share with you our webinar, our knowledge about equine trigger points and dry needling. My name is María, and I am a veterinarian specialized in equine rehabilitation. I am also an acupuncturist, an equine acupuncturist, and I have always had interest in equine sports medicine and rehabilitation. When performing conventional treatments, I realized that it is essential to have an integrative approach in order to go to the origin of the pathology of the problems and understand better the clinical case. So, okay, as Maria have said, we are instructors of Equine Dry Needling in Myopain Seminars, and we are researchers also in this field, an emergent field in equine veterinary physiotherapy and medicine. So I'm going to start, and let's go.
Okay, I'm going to start with an introduction of dry needling and pain assessment of the horse, and then Maria will continue with trigger points identification, dry needling technique, and case report. Okay, so let's go. So, do horses have trigger points? Which is the etiology? How do trigger points appear? Yes, trigger points in animals are comparable to those in humans. As we have a diverse audience, we want to remember that a trigger point is a hyper-irritable spot in a palpable taut band of skeletal muscle fibers that produce local and referred pain among other symptoms. And which is the origin of these trigger points? When a horse performs eccentric or concentric exercise in unfit muscle, in a weak muscles, there is a muscle fiber damage. There is a sarcomer breakdown. And in the horse, the most common muscles in developing trigger points in response to stress situations or overuse are brachiocephalicus, back muscles, gluteal, and hamstrings. Besides, the sympathetic nervous system adrenergic activity results in capillary constriction, which leads to hypoperfusion of the muscle. So, as you can see in the slide, the resulting ischemia and hypoxia produce a local acidic pH. In this acidity situation, there is a release of inflammatory substance that activate muscle nociceptors and cause pain as ATP, potassium, bradykinin, serotonin, prostaglandin. This substance stimulates cytokines as tumor necrosis factor, interleukins, and calcitonin gene-related peptide. So, what is the consequence of all of this? The consequence is that this inflammatory substance inhibits acetylcholinesterase facilitates acetylcholine release and upregulates acetylcholine receptors. The result is an increased acetylcholine activity with increased frequency of end plate potential and the formation of taut bands. So this is the integrated hypothesis, and it is the most accepted explanation of trigger point formation. So when the owner calls the clinician, when the trainer calls us, which are the main complaints? What has the owner, the trainer, the rider observed in the horse? So the main signs can include restrictions in the pole, hard on the beat, a head lifting, back stiffness. This is very common in all the sport horses. And it is also common to find a difficulty to bend, for example, in lateral exercise, lack of hind limb engagement, the typical bunny hopping movement, for example, we can see in the sacroiliac injury. It is also important the clinical signs associated with difficulties in transitions, for example, between trot and canter, lack of suppleness in general, girth, aversion, and bad behavior. And in this situation, what about dry needling? Is this technique effective to treat trigger points in horses? Okay, we want to remember that dry needling is a technique which uses a thin filiform needle to penetrate the skin and stimulate trigger points, muscular tissues, and connective tissues. It is used by physical therapists as part of their clinical practice in combination with other physical therapy interventions, and it is very effective for the management of muscular pain and movement impairments. And the effectiveness it is important that the effectiveness depends on an accurate palpation. This is very important, okay? And we will talk about that later. So, as you can see in the slide, the insertion of a needle can elicit a local twitch response. And what is this, a local twitch response? Okay, this is an involuntary contraction of the trigger point. Some studies have demonstrated that when a local twitch response is elicited, all these things happen. Firstly, the end plate noise is suppressed, leading to a lesser spike electrical activity. The concentration of this inflammatory substance and nociceptive chemicals is lower, and there is also an increased muscle blood flow and oxygenation, and a release of endogenous opioids. So dry needling is a technique with a lot of benefits for our patients. And when we are treating a horse, many people ask me, okay, Maria, what are you doing? Dry needling, but dry needling, is this acupuncture? Is the same? Okay. So it is true that acupuncture and dry needling use similar needles, but they are completely different interventions. Acupuncture is based in traditional Chinese medicine, whereas dry needling is based in a Western approach. In acupuncture, the goal is to treat all kinds of pathologies, digestive, respiratory, muscular, okay, rebalancing the flow of energy in the body. And the acupoints can be located in the meridians along the body and other parts of the body. And they are treated with needles. But dry needling only treats trigger points, okay? These are the difference. And okay, before planning any treatment, medical or physiotherapeutic, it is essential to perform a good clinical reasoning. We have to interpret all the parameters or skills involved in a physiotherapy assessment. And okay, now I'm going to talk about the main skills that are useful in the assessment. Okay, having a good communication with the owner, with the handler, trainer, groom, farrier, in general, with all the people involved in the horse's care. Assessment of rider posture, saddles, and bits. It's very important also. A poor saddle fitting can develop trigger points, can develop muscle injury, and an excessive weight of the rider or rider's asymmetries can influence to develop back pathology, for example. Having a good power of observation is very important, and having a knowledge of anatomy and palpation is essential. So here,
Vale, cuando quieras.
Here you can see a couple of videos of a dynamic evaluation in circles. First at walk and after at trot and canter.
Vale, cuando quieras.
We observe the horses to get information about the patient. Okay, the next video. We pay attention to the quality of movement, placement of hind limb with respect to forelimb, general mobility of trunk, neck, pelvis, degree of impulsion of hindquarters, recruitment of abdominal muscles, symmetry of the diagonal limbs,
Vale, cuando quieras.
coordination, ability to engage the hind limbs, etc. Okay. So in the static observation, we assess the conformation and other abnormalities such as swelling, scars, symmetry, muscle atrophy, alignment of extremities and the spine. And we usually observe the animal from a lateral, cranial, caudal, and sometimes a dorsal aspect. Okay, I love this slide. This one shows nice pictures of different breeds of horses in several disciplines. The main idea is that the conformational pattern of a horse determines its sport aptitude. So there is a strong association between conformation, injuries, and development of trigger points. Okay? A knowledge of anatomy and biomechanics is essential for clinicians. It is necessary to have a clear understanding of the structure and function of the specific area. And we like to use a 3D software like the one you can see in the slide because it allows you to have a more practical view of the animal. Okay. One of the most important things concerning dry needling is to have deep anatomical knowledge before needling. When you are confident in anatomy, it is easy to perform dry needling technique. You need to know what muscular functionality needs to be restored with needling and what body structures have risk to be needled, as for example the jugular groove when needling neck muscles or the lungs when needling the back. So anatomy is very important. And general palpation plays an important role in the communication between the clinician and the animal, and it is a precedent to deeper palpation. In addition, a side-to-side comparison of findings is important. So in this general assessment, we perform mobilizations to test the range of motion of the animal. As you can see in these pictures, there are two examples of mobilizations, okay? And why is this important? Because trigger points affects movement, so it is very important to test the range of motion. And what about pain? What about pain assessment? As I have said, trigger points can be a source of pain, and the assessment is essential. In veterinary practice, an adequate diagnosis depends on the recognition of pain experienced by non-verbal animals, and this difficulty in pain assessment is commonly addressed, and self-report is not an option when assessing pain in animals. And do horses suffer from myofascial pain? What is myofascial pain syndrome? Okay, this syndrome is defined as the sensory, motor, and autonomic symptoms caused by trigger points. In horses, myofascial pain is often the reason behind many poor performance and behavioral issues. Okay, in contrast to human medicine, myofascial pain has been poorly investigated in animals, and human physiotherapeutic techniques usually are extrapolated to the animal field. So, what tools are more useful for the clinicians to detect pain in the horse? So, we are going to talk about facial expressions and behavioral changes, because physiological parameters are also an objective measure of pain, but some studies have demonstrated in general terms that they are not very useful for orthopedic pain. Okay, so next, different facial and behavioral signs are described by Glirup and Dalla Costa. These facial signs include the position of the ears, tension in the eye, nostrils, and muzzle of the horse. And behavioral aspects include kicking, changes in the position of the head and neck, an escape reaction, movements of the tail and legs, etc. As you can see in the first picture, the facial expression of the horse is normal, but in the second picture it has clearly changed. It has turned the head towards the clinician, and there is more tension in the eye area, and the ears are also in a low position. Okay, so in this slide you can see the studies mentioned above. Glirup investigated the existence of an equine pain phase and described it in detail. And in this study, pain was induced using two noxious stimuli, and they were applied to the horses for 20 minutes. A tourniquet placed around the anterachum, and a topical application of capsaicin cream on the lateral aspect of the hind limb above the hook, and an ethogram of the components of the horse's facial expressions was constructed based on the video recordings. And in the other study, Dalla Costa developed and validated a pain scale based on facial expressions in horses that underwent routine surgical castration. Okay, the horse remains scale was developed and comprises 6 facial action units, as you can see in the slide. Okay, stiffly backwards ears, orbital tightening, tension above the eye area, prominent strained chewing muscles, mouth strained and pronounced chin, strained nostrils and flattening of the profile are the 6 facial action units. And what this study conclude? They conclude that horses undergoing castration show significantly greater pain scores comparing to control group. Okay? So, in these videos, I stop the second one. Okay. In these videos, we can see the behavioral differences when the clinician is palpating the brachiocephalicus muscle. And this muscle, it is very important in therapy, and runs from the pole area to the humerus. And it is typically stiff in the distal part, the cleidobrachialis part. In this video, we can see a very, very relaxed attitude of the horse. Okay, again. There is no tension in the eye area. The ears are in movement in different directions, and sometimes it seems that the horse wants to play. Okay, in the second video, okay, the horse is very reactive to palpation. Turns and lifts immediately the head and neck towards the clinician, and he wants to bite her. Okay, so you can appreciate this. And it is very important to see these changes in the animal. So, Dyson, an important clinician and researcher in equine lameness, described a facial expression ethogram specific for ridden horses, and she also differentiated facial expression between horses with lameness and horses without injuries. Okay, so in her study, there are some key observations that may be good indicators of the presence of pain. And these include severely above the bit, twisting the head, the bit pulled to one side, ear position, partial or complete closure of an eye, exposure of the sclera, tension caudal to the eye. So these are the main signs. And she also found that salivation is considered to be a sign of acceptance of the bit and relaxation of the animal. And what is the importance of this study for us? Okay, the observations of these signs could help the clinician, could help us to see in what ridden exercise the horse shows more pain. Okay, so María, is your turn. Thank you.
All right, Maria, thank you very much. And now it's my turn. I will keep on going. So, what about equine trigger points? Can they be identified? Okay, this is what we are going to talk about next. The scientific literature we will review is focused in dogs and horses. However, there is a new update in diagnostic criteria for humans that must be taken into consideration in order to extrapolate it into animals. As objective tools, when diagnosing trigger points, we have manual palpation and algometry, but manual palpation is the key. Concerning the first studies in animals' trigger points back in the 70s, exactly in 1976, Simons demonstrated for the first time an histopathological evidence of trigger points in dogs. You can see here nice pictures of longitudinal sections of isolated contraction nodes from the gracilis muscle in dogs. You can see in both figures 12 and figure 13 with the red circles, the contraction nodes. And you can see also in figure 2 a striation pattern of the adjacent fibers. Later, Janssens identified 82 trigger points by palpation in the muscles we have circled with those red points
that were triceps brachii, infraspinatus, peroneus longus, gluteus medius, ilicostalis lumborum, adductor and pectineus in the picture behind, and quadriceps femoris. All those muscles they found out in 48 lame dogs. They were also treated by dry needling or by injection of 1% lidocaine at weekly intervals. Of the 82 trigger points, 29 disappeared completely, 19 treatments had good results, and 26 were ameliorated, and 8 had no improvement. Later, in 2013, Wu described basic palpation techniques as flat palpation and pincer palpation to diagnose trigger points in horses. You can see in the pictures they are palpating on flat palpation, and the clinician is palpating in pincer palpation the quadriceps muscle. In the small picture on top, you can see the clinician needling the muscle. Well, he remarked that effectiveness on dry needling depends on the ability of the clinician to detect trigger points. So, as we have said previously, a good knowledge of anatomy is essential. Then, in 2015, Frank adapted trigger point diagnostic criteria used in humans to be used in dogs, and he concluded that human model of myofascial pain syndrome was very useful for these animals. Physical examination, followed by muscle palpation, provide confirmation of the presence of trigger points. So, what about horses? When my colleague María and I started research in this field, there were only 2 references in the scientific literature. This is one of them, and the other one, which is in the next slide, is about electromyographic. So, in this one, Bowen et al. Described for the first time the location of trigger points in the pectoral region of horses. As you can see in table number 3, they score the severity as mild, moderate, and severe. They associate these findings with a girth aversion behavior. Todd bands were identified by palpation in 38 horses in a physiotherapy assessment. Trigger points were identified in all horses, and the most common regions was the axillary region of the ascending pectoral muscle that was covered by the girth. As you can see in table 1, Pony Club and Pleasure horses were the disciplines that have more trigger points. The difference between disciplines were attributed to the variety of workloads and training methods used. The most common girth aversion behavior seen in these horses was turning the head to look at the girth area while fastening the girth. Horses with a history of girth aversion behavior had higher severity scores. You can see the both drawings. In the 13 girth adverse horse, the shading is showing the average severity, and the overlaid numbers are the number of horses with a trigger point for each cell. McGregor et al. Explored for the first time the electromyographic characteristics of trigger points in the equine cladiobrachialis muscle, which is one of the most stressful areas, and he compared them with normal tissue muscle. For horses with chronic pain and poor performance showing myofascial pain syndrome signs were included in this study for acupuncture treatment. All of them demonstrate tender points in a taut band of muscle, which produce the same of the signs that were found in humans, as a jump sign and local twitch response on snapping palpation. This is what they did. If the location of the trigger point corresponded to an acupuncture point, an examination with an electromyographic needle was performed at this point. A trigger point located in the cladiobrachialis muscle was the most frequently examined site for the electromyographic activity. You can see here in figure number 2 with the recordings of the end plate noise and spike activity of the trigger points, and behind you can see the non-trigger point drawing. So you can also see in these graphics on the right hand side the frequency of the spontaneous electrical activity, the spike activity, and the local twitch response in both trigger points and control site. The 4 patients in this study show signs of spontaneous electrical activity, spike activity, and local twitch responses at the trigger point sites compared to control sites. And the type of electrical activities was similar to those found in humans. This is the new update in diagnostic criteria for humans that I meant before. According to Fernández de las Peñas, at least 2 of the following criteria must be present for essential trigger point diagnosis: a taut band, hypersensitive spot, and refer pain. Local twitch response is a confirmatory criteria. In contrast, McGregor includes local twitch response elicited on snapping palpation as a recommended criteria, and refer pain is lacking from his recommendations. He also describes the challenges in acquiring identifications of trigger points. In our clinical experience, it is very difficult to elicit local twitch response on snapping palpation in many muscles of the horse, and it is almost impossible to detect refer pain in a non-verbal subject. So let's get now into the objective assessment. Here you have 3 pictures of flat palpation, pincer palpation, and snapping palpation. So manual palpation is performed in 3 ways, as well as in humans. We have flat palpation, which in horses gives us information about the tension in the area. This is a good way of palpation many muscles in the horses, such as epaxial muscles, hamstrings, gluteal muscles, triceps, quadriceps, and cervical muscles. Pincer palpation, although is the way we get more information, and it's the best way to find a taut band in a muscle, in the horse is not easily used in many muscles. We mainly use pincer palpation in brachiocephalicus, pectoralis, biceps, and perhaps triceps. Snapping palpation is very useful for trapezius, infraspinatus, splenius, and epaxial muscles. In this slide and the next one, we want to talk about our research in acquired myofascial pain. When Maria and I started researching, we firstly wanted to know 2 things. 1, if palpation was reliable, and 2, if an algometer could be also a reliable tool to evaluate myofascial pain. So we started evaluating the intra-aortic reliability in the location of a trigger point in the brachiocephalicus muscle. And then we researched on the reliability of the pressure algometer tool, which you just will see in the next slide. In our first research, this one on the left-hand side, we found the location of a trigger point in brachiocephalicus muscle is reliable for one examiner. And in the second study, we found acceptable reliability for the measurement of pain threshold in the same muscle. Merrifield here in the right-hand side did something similar. They evaluate intra-aortic reliability in 3 tools: palpation, pressure algometer, and flexiflor sensor, and intra-aortic reliability in the pain score of palpation. They recommend to use a simple palpation score system in clinical practice to increase objectivity during palpation assessment. In the next slide now, you will see a couple of videos showing a horse reaction to algometer. One of the horses it's very reactive, and the other one is a non-reactive horse on the pressure algometer. So you have seen the brown horse who was reacting, and now the gray one is happy with the pressure algometer. See, he's doing no reaction. He's relaxed, moving ears up and down. He's not bothering at all. So going back to the beginning, could dry needling be considered as a treatment for acquired myofascial pain? Well, according to our first study, yes. So this is the first study. In horses, there is no literature about dry needling except our clinical commentary published in 2016 in the 9th International Symposium of Veterinary Rehabilitation and Physical Therapy. The aim of this study was to investigate if dry needling could be an effective technique to reduce pain in equine brachiocephalicus muscle. We performed manual palpation of the distal end of the muscle in 9 horses, and 2 were excluded to the lack of a painful response. You can see, and you've seen before with María, the videos of the horse reacting to the palpation. This is this white one who had a strong behavior reaction to palpation, and behind the gray one who had no reaction. 7 horses demonstrate signs of pain, and we found local twitch responses in all of them during treatment. We measured pain threshold using a pressure algometer before treatment, 1 hour and 72 hours post-treatment. As you can see in the pictures also here in the poster, we have the palpation picture. There's another one using the algometer, and there are 2 needling the horse. There was an improvement on the right side after 72 hours post-needling. We think that the reduced sample size was one of the limitations in this study, so what we are doing now is keep on researching. Okay, we are going to get into the technique of equine dry needling, and I will explain then a case report. So we would needle on flat or pincer palpation depending on the target muscle. The procedure will always be the same. In the first picture, we needle guide toward the trigger point. We tap the needle in, and in the second picture, we needle directly to the trigger point, and we do this coming in and out of the muscle to elicit local twitch responses until they are abolished. In case of necessity, then we apply hemostasis if there has been some bleeding. Now I'm going to show 2 examples of how we study the technique of dry needling. It is very important to have good knowledge of the anatomy, as we keep on saying, and the different instructions of how to needle each specific muscle. We always have to be aware of the precautions in order to avoid needling other structures. Needle size is also important and dependent on the particular muscle. Medial gluteal, for example, is a muscle that we needle a lot, and it is responsible of many of the issues that riders and trainers have with their horses. For example, it is very important when dealing with sacroiliac dysfunction, as you will see in the case report. At some point, needling medial gluteal helps releasing the lumbar epaxial muscles, and those are muscles that are usually very stiff. This is also a muscle where we use safety tube needles, which I will describe later. Those needles are very useful, as you will understand in a few slides. Brachiocephalicus is one of the muscles in the horse that we can palpate easily in pincer palpation. This is one of the reasons why we have chosen it for our research. And it is also a muscle with a high prevalence, especially in classic dressage horses. It is very, very painful for them. Trigger point in that muscle affects both flexion and lateral flexion of the neck and protraction of the forelimb. The next slide,
you will be watching myself needling brachiocephalicus. Pay attention because at the very beginning you will see a local twitch response. There it was. There was another twitch there. Another one. Another twitch. 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 So, I'm sure you have seen some very clear local twitch responses, haven't you? And aren't they nice? Well, I just love them. I think that's one of the reasons I love this technique, because it's giving me direct feedback for how the muscle is and comfort me that I am on the correct path. Clean hands, gloves, sharp containers, yes, we use all of that. Gloves are not compulsory, still we like to wear them. The most important rule is to have a good hand hygiene. We can have some issues needling. Sometimes the needle gets stuck in the skin. This happens especially in places where fascia is thick. You can even feel the crunchy texture of the fascia. What we do then is to rotate the needle, as you can see in picture 2, and let the tissue resolve the problem. A couple of minutes and the needle gets released. Sometimes, like you can see in picture 3, you also get the needle out completely bent. We assume it's because the horse has made a contraction of the muscle. Remember that they do not stay laying down like we do in humans, so the muscles are activated. Because we use agopun needles, there is no risk for them to get broken. So this is also important. Do not save money on the needles. They are inexpensive. Well, here we have the safety tube needles I meant before. This one in the pictures are 35 millimeters times 100. Well, we also use 30 times millimeters times 75 millimeters. They are both quite long, so the longer needles we use are these 100 millimeters. The main issue with them is that they bend before getting in when they are so long, so when the fascia is thick, it makes it very difficult to get the needle in. Safety tube needle help us introducing the needle as we have the possibility to hold it from the pink tube. And here in the picture you can see how we do it. So first picture, we tap the needle in the skin, then we release the long tube and we hold the needle from the pink one. And we keep on pushing the needle in, like you see in the third picture. Once it's in, we can remove the pink tube and keep on needling. Easy, right? Getting to the part of complications, precautions, contraindications, and risks. We have borrowed from Johnson McAvoy his trigger point dry needling safety model, in which you can see how important it is to take everything into account before performing the technique. Safety is very important. Actually, we haven't found ourselves any complications needling horses. Perhaps some bleeding, yes, but nothing that cannot be resolved with hemostasia. Of course, you have to be very aware of forgotten needles. You cannot needle inside the stall, as the risk of having needles falling is high and it will be very difficult to find it there. Pneumothorax is easy to avoid as we don't needle thoracic muscles and we are careful and aware of the precautions while needling longissimus. You must be aware of the risk management actions and also the contraindications. Something that happens, not very often, but happens, is to have horses with fear of needles. You cannot put yourself in a risky situation. If the horse is not happy, being distracted by the caregiver, or maybe with a carrot, then maybe you have to consider sedation. The vet has to be with you and control the sedative procedure. Yes, we have found horses that need sedation, and it is not what you really like to happen. But in those cases, balancing the need of sedation with the benefits of the technique is a good idea prior to proceed. This study in humans tells us that there are very few cases of major adverse events. You can see Table 1 with the minor adverse events and Table 3 with the major adverse events. Bleeding, bruising, and pain are the minor adverse events more frequently found. In horses, bleeding is resolved with hemostasis. Bruising is very difficult to see, and little horses show pain while needling. At the moment, as I've said before, we haven't had any of those, but little bruising. Little bleeding. Not even pain during treatment. Surprisingly, most of the horses are comfortable with the needling. And even more, we had a quite nervous horse that would get calm as soon as we start needling him. Well, I love that horse. He was my favorite. It was very easy to needle him. But we also have a mare that even with sedation, she doesn't let us approach her with a needle. So everything can happen with horses. This is the case report now we want to talk about. You can see this horse doing this bunny hopping canter with kicking. Again. And again. Alright, this video was sent us the week before we visit the horse. And we visit the horse 3 times. The first visit, when we went to see the horse, we saw that it was a very nice horse that was seen by a vet. He is a 10-year-old jumping horse, and the vet evaluated the horse and recommended the owner to infiltrate the sacroiliac joint. But the owner decided to try the less invasive procedure, and she called us. He was doing this bunny hop canter, especially on the left-hand side. This is one of the clinical signs you expect to see in a sacroiliac joint dysfunction. We told the owner the importance to have a previous echographic diagnostic in order to discard an injury. While lunging the horse in the dynamic assessment, left foot was tracking narrow behind the mass in order to stabilize the pelvic region, and there was no dissociation in the transitions to canter. There was instability and irregularity in the stride on both sides. Difficulties to initiate transitions, no movement in the lumbosacral flexion. Canter on the right-hand side was a little better. On the static evaluation and palpation, there was pain in brachiocephalicus muscle, which is something we almost find. There was a stiffness in the longissimus lumbar, mobilizations of the tail were okay, and there was no fixed tail on one side, which is a sign of sacroiliac ligament injury. Coxofemoral joint mobilization on the left-hand side was restricted, and tuber cocci was lower on the left-hand side also. He was able to perform all dorsolumbar reflex. Well, as a physiotherapeutic treatment, I perform gentle mobilization of dorsal and lumbar spine, lumbosacral and coxofemoral joints. I treat with a massage gun longissimus lumbar, medial gluteal, hamstrings, and fascia thoracolumbar. And then I try needling longissimus lumborum, medial gluteal, and semitendinous bilateral, as well as brachiocephalicus muscle. I perform some dynamic mobilizations, exercises, and recommend the owner the following. Not to ride the horse the next day and let him free outside. The next 2 days, no canter, no lateral work, and light breathing work. Free time was fine. 1 day a week of lunch work and perform carrot stretches 3 times a week. And then we plan the next visit in 10 days, depending on the evolution. The second visit, the horse has been ridden gentle for 1 week. His extended trot has improved.
He is using more his feet, and he's doing little bunny hop cantering, but no more kicking. His left hind foot is less under the mass. He has improved the lumbar sacral flexion, although he has not recovered all the movement. I repeat the treatment and also perform some gentle stretches in protraction and retraction of the hind limbs. Also perform some core exercises like isometric contractions of medial gluteal, and give recommendations to the owner in terms of free time for the horse, no canter nor sitting trot. Well, keep the training with a therapeutic position and let the horse go and long is important, and introduce collet work at the end of the week. Okay, and then we went to the third visit, and this is the video we got before the third visit. The horse is moving more supple, with more suppleness, more gentle. He is cantering correctly both sides. He's improved quite. So the owner says that the horse is doing much better. In the third visit, this video was the day before we went for the visit. In the dynamic assessment, he's feeling more comfortable and he's moving with more suppleness. He's more stable on lateral movements and there is no bunny hop canter. That day the horse was a bit nervous, the day of the treatment. Sometimes you just have to deal with horse's mood and it's difficult to know what's making the horses like that. Still, I could treat him well. I recommended long and low training and carrot stretches 3 times a week, and plan to talk to the vet for the ecography follow-up. Well, here you have all the references. You want to take a look? Well, thank you very, very much for your attention and feel free to ask questions.
There's one question from Laura. What type of needles do you use?
All right, I can ask that. Okay, we use Agupun needles because they are not going to break. They give us a lot of confidence. And we usually use, depending on the muscle, we usually use between 30 millimeters or 35 millimeters times 40 millimeters long till 100 millimeters, depending. For gluteal, the maximum we use is 100 long, and we usually use safety tube, as I said before. Brachiocephalicus, we can use 40, more or less, long, and between those, 60 also long, 75, but always Agupun needles.
Yes,
So another question from Nina.
safe.
Are there any thoughts on difficulty with needle penetration in the lumbar paraspinals?
On
the
no,
lumbar paraspinal?
no, not difficulties. Why?
No.
Actually, the skin there is quite easy to get through, but you have a thick layer before getting to the muscles, thick layer of tissue. But no, actually, we have more issues sometimes needling biceps femoris or gluteal medial to get the needle in. But no with lumbar paraspinals, no.
Yes, gluteal muscle is a very powerful muscle, as you know, and sometimes dry needling is a bit difficult because you can find a lot of tension in this area. And yes, it's
And
easy to needle
Sorry,
it, but it's hard to needle the gluteus.
Sometimes what I have found in our clinical practice is that needling gluteal, you can release the tension in lumbar facial muscles. So maybe that could be a good trick for you. Maybe this can help you when you are having issues needling that muscle, yes.
Okay, here's a question of someone who would like to know where you learned physiotherapy first before you got into equine physiotherapy.
Okay, I studied physiotherapy in Spain. I specialized then in, well, I first took a master's science degree in osteopathy, and then I studied equine physiotherapy, and then I specialized in dry needling, equine dry needling, after specializing in human dry needling. But I studied physiotherapy in Spain.
Okay, here's a question from Catherine. Is pregnancy considered a contraindication?
María.
Okay, in general, there is no scientific evidence in horses, dry needling, and pregnancy, but we try to avoid the first steps of pregnancy, or the steps of if you find that some risky pregnancy, it is better to don't practice dry needling and wait until pregnancy has finished. So it would be better. But in general, if the horse is stable, there is no problem. Okay, you can do it, but I prefer not to do it, not to needle. I prefer to wait. But there is nothing in the scientific literature about it.
Well, there is nothing, of course, in equine literature about this, and in humans, if we want to translate into horses, they rather prefer not to needle the first 3 months of pregnancy, just to avoid issues like the woman, in case I'm talking about humans, she's not happy with the needling after, and then there is a problem or complication with pregnancy that they kind of think it can be due to dry needling. So sometimes, because there is no evidence in horses, then we try to apply those in human.
Are there outcome studies of dry needling and the effect on the treatment of horses?
No, there is no research. No, of the outcomes, no.
We have to extrapolate a lot of things from humans, because there is no.
Well, as I said in the presentation, all in research, all the scientific evidence is this first study. Well, all those 3 studies in dogs and the 2 studies from pectoralis and electromyographic, and then all the research Maria and I are doing. But there is no more scientific evidence in equine dry needling.
When we started to do it, we didn't have any reference except the two papers that Maria has said.
Okay, another question from Jamie. Do you find latent trigger points in horses that are not so painful that you would needle?
Okay, all right. I found this a difficult question to answer.
Yes.
Because when we describe the difference between active and latent, if active is a trigger point that there is a complaint, the patient complains about the trigger point, and latent would be painful when palpating, it is difficult because the horse won't tell you, well, I have pain in my brachiocephalicus, and then you say, yes, it's a trigger point. Let me touch it or palpate it. I mean, you don't have feedback from the horse. So how do you make the difference? I am just sending this question to the air. How do you find the difference between a latent trigger point and an active trigger point in a horse if self-report is not an option? So I palpate, and if the horse is complaining and I find the taut band, then I needle the horse. Yes. And I just don't ask myself, actually, even though it's a good question, maybe we will have to think about that, Maria, to give a scientific evidence answer. Because
there is a, sorry.
No. I was saying that I just palpate the muscle, and when I find the taut band and the trigger point, if the horse is complaining, then I needle the horse. No wondering whether if it's latent or active. But actually, it's a very good question. Thank you.
Yes, and yes, as Maria have said, there are obviously a lot of difference between verbal and non-verbal animals, no? In this case, and for example, referral pain is very difficult to detect in the horse. Also, there are a lot of things that, as they can't say, it is very difficult to detect.
Well, in our clinical experience, for example, I just can say that sometimes when you are, I many times palpate lumbar muscles with a special tool, because just to get my fingers a bit of relax, because sometimes it's very hard. And you can see kind of a fasciculation, probably, or going all the way up to more cranial or to the gluteal muscles. Maybe you could guess that is referral pain, but of course the horse cannot tell you, oh, when you are palpating in brachiocephalicus, I feel some pain in the humerus or near trapezius or wherever it goes the pain.
Okay,
Here
another question. Sorry.
Yes, I can see a question, Jan. How often do you recommend to do the next dry needling? Yes. Well, in general, we wait for 7-10 days for the second visit, but it depends of the patient, of the evolution of the patient. So, and it is very important also to think about the possible pain post-punction, post-needling. In our study, we realized that after 72 hours post-needling the horse in this time, before this time, sorry, the horse had a bit pain because of the intervention. And after 72 hours, the horse was have improved. So you have to wait after needling the first day, after the first visit. You recommend to the owner to leave free the horse in a paddock, and you recommend to start rhythm work, for example, at 48-72 hours. But in the scientific literature, the myocyte regeneration is described as 7-10 days after needling. So we wait for a week, 10 days, if the horse needs a second visit. Or what percentage of horses do you have to sedate, to needle? Okay, we usually don't sedate horses. Okay,
very little. Maybe actually we have nowadays 2 horses that we have to needle. Very, very, very little. Very little.
Yes, and you have to think about. I think that in our clinical experience, for example, if you find a horse with bad behavior or a complication in the behavior, maybe the first visit you can try with other manual techniques and to wait for a more relaxed horse, and you can wait 2, 3 visits to needle the horse. Okay, so you have to be patient with the horse, and you have to do to evaluate if sedation is a good option. So, but in general, we don't need this intervention. And in general, dry needling is a very well accepted technique. Okay, horses surprisingly accept very well the technique. They are very relaxed, and in general terms, there are no problems with the behavior when needling a horse. Do you needle the dorsal scapular ligament region and the sacroiliac ligaments?
Do you needle?
Needle the dorsal scapular ligament region and the sacroiliac ligaments.
No.
No, no. We needle muscular tissue. Okay, not ligaments. We can heal if you have desmitis or you have a problem in a ligament. You can help this problem relieving tension of the muscular area next to the ligament injury, but no, not ligaments. Is the age an important factor when you are going to needle the horse?
No. No. Well, we treat mostly competitions horse, and you find horses with 4 years just ready to be needled with loads of tension in the muscles and overloaded muscles also. So no, actually we see horses from a range from 4 years to what, 10, 15 years, Maria, more or less. That's the age we usually see. No.
Another question. I find the thoracic epaxials very sensitive, okay, and a difficult area to needle. The horse tends to twitch and then spasm, and some have severe effects. What is your experience of needling in this area? Okay, the thoracic epaxial.
Okay, it depends on the horse. I mean, sometimes when the area is very sensitive, you have to be careful because the horses are sensitive. I mean, the skin of the horses is sensitive and they are quite reactive. So even to palpation, they are reactive. So when there is pain in the area, because it's a very painful area, they tend to overreact of the pain. So needling that area as well as lumbar area, you have to needle gentle. That's our way of doing it. You go gentle. Like brachycephalic, you have to go gentle, for example. So that's a little bit more or less the idea. Try to be gentle and calm and do it with softness. Yes. You can start with a short needle, for example, because sometimes trigger points are closer to the skin. I mean, in the superficial areas of the muscle, more rather than we think. For example, also in gluteal medius, which is quite deep. So you can start needling with 30 times 30 needle, which is quite short, and because we used to hold the needle from the, not directly, in the middle, in the border. So you needle, you you just leave 1 centimeter out. So 30 it's fine to start with. Yes. More questions, Maria?
Is dry needling allowed by the FEI, International Equestrian Federation, at international competitions as part of physiotherapy?
No.
No.
You cannot needle horses in competitions. No. If they are competing, you just cannot use the technique.
Are horse owners receptive to dry needling? Yes.
Yes, no big deal.
Yes.
No big deal, no.
In general, the technique is well accepted. So
yes.
it's
we usually explain them what we are going to do, especially if it's the first visit. We explain them what's myofascial pain. There is also an agreement, consent form, so they know the precautions, the complications, and you explain what the technique is. You talk about pneumothorax, for example, even though it's a very rare complication in horses. Of course, I told before that we don't need that area. Still, you just tell them and you say, well, that the horse can faint or can sweat, or those reactions can be normal, and you explain them about bleeding and hemostasia. And of course, you explain all the benefits of the technique about pain and dysfunction, weakness in the muscle, etc. But they are usually happy with needling.
Yes, it's important to sign the consent form, okay?
Yes, it's very important.
Sometimes it's typical that you are, okay, you know how this work is. You are in the stables and okay, you can forget this, but it's a very important part of the assessment, okay,
yes.
to give to the owner the consent form and to that the owner sign.
Also because the owner has to be tranquil and has to understand what you are doing.
Yes.
So
yes.
I think it's good for both, for the owner or trainer and for you
yes.
as a clinician.
Yes, of course.
Give the information to the owner and he can feel confident of what you are doing. So
yes.
in both directions, it's important, yes.
In your professional routine, you have to be that the owner sign the consent form. Where are you both working? We work in Spain. Nerve needling is possible in horses. Yes, of course. You can.
¿Cómo? I didn't understand.
Nerve to needle a nerve.
Yes.
Nervio. Yes.
Well, okay.
Yes, you can needle. Yes.
Okay, this is the rule for humans is once you needle a nerve, you have to ask the patient that if there is an itchy pain, the patient has to tell you. Of course, this is impossible again with horses. So if you needle a small peripheric nerve, of course you avoid and you take all the precautions not to needle a big nerve like sciatic, for example. But when you have superficial nerves, sometimes the horse reacts or makes a movement or just, depending on the character of the horse, makes a little kicking. So you have to be aware that maybe that's the possibility that you have hit a small nerve. You just have to release the needle and just try to do it a bit farther of that location.
But there is no problem. Sometimes it's normal that you needle a nerve, okay? But for the horses, it's not a problem. If palpating and find a taut band and it's not painful, do you needle or only painful points?
This is a very, very good question, I think, in my opinion, because what you always do when you find a taut band is just you go along the taut band looking for the most hypersensitive spot. There is where the trigger point actually is. So if the horse is not in pain, This has never happened to me, actually, I think. But it is a very good question. What would you do? I probably, if there is no dysfunction, then I doubt it that there is a toad band with no pain, actually. I doubt that, really. Or you might find dysfunction, and I probably needle it. I think so, Maria. What do you think?
It depends. It depends also on the previous clinical history,
Yes.
clinical assessment. This is why it is very important not to needle from a mechanical point of view. Okay, so I'm going to needle all the big muscles of the horse. Not. It is very important to do a good clinical assessment previously. Okay, this is the most important part, and you have to do a good evaluation on dynamic assessment and the biomechanics, the functionality of the horse, what happens with the horse, and then you have to think about, okay, what muscles are more prone to develop, in this case, trigger points, and okay, so because sometimes it is true that some breeds of horses don't express the pain very good. Okay, I remember that Frisian horses, for example, it's a breed that they usually don't express the pain very clear. So sometimes it's difficult with horses. Okay, it is difficult, but rely on your assessment, on your previous analysis, and then needle.
Because the needle is so thin, you will only treat a few muscle fibers. How will that affect the whole muscle?
Yes, I can. Okay. Again, this is a very good question, because sometimes as a clinician, and because there is a lack of scientific research, well, for example, especially in gluteal muscle and these deep muscles, I have the doubt whether you are not treating the whole muscle itself. I think it's not depending on the thick of how thick or thin is the needle, but how deep you can get to the end of the muscle, or you can needle the whole muscle. So because we can use 30 millimeters or 35 millimeters, and many times, for example, I rather prefer to use 30 than 35. And actually, even though it's a little difference, it makes a big difference when you are using it. You can feel it, that you are just going through, I mean, that the penetration of the needle, it's thicker. So yes, there is no evidence, but the technique is effective itself, even though sometimes you think you don't reach to all the muscle. Still, what we do is we needle when you palpate tension in the area or the toad band, and you get the local twitch response. So you assume that in the depth you are using the needle, you are resolving the issue. I think it's not a problem of thickness, I think, but also I have to say that you spend a long time needling a big muscle. I mean, it's not a question of 2 minutes. If you have to needle quadriceps or hind limbs, or again gluteal muscle, which is a muscle that we needle a lot, it's not a question of 5 minutes. You can get many local twitch responses from a big muscle in the horse. Even brachiocephalicus, where you needle behind C3, so you don't needle all the way through the muscle, you get plenty of local twitch responses. And sometimes, as a clinician and sharing my experience with you, I have to say that you sometimes stop needle, not because you think you are done with the technique or because you think you have treated the whole toad band, for example, but because the horse is already upset or tired of the technique. So sometimes you just stop because you've been maybe 1 hour or 45 minutes needling the horse, and the horse is just tired. So I hope I have answered your question.
Can we use dry needling with electrical stimulation in horse? We have no. I don't use electrical stimulation because I have found that the main results with dry needling, I have better results than electrotherapy. But it's my experience. But you can, if you want, you can. But it is important also, as Maria have said, it is important to maintain the horse relaxed and not to perform a lot of techniques one day, okay? You have to evaluate the behavior, the personality of the horse, and some horses don't like needles, so you can choose other techniques and don't needle the horse. And it depends, no? What do you think, Maria?
Yes, I mean, I am like you. I mean, we both are more focused on manual therapy or myofascial pain. So, I mean, I actually don't use either electrical stimulation nor other devices. So yes, it's like Maria says, it's clinician has their own resources and the way of treat the horse. In my opinion, releasing fascia, it's very nice. As previous to needling, I usually use massage gun, which I like very much, and I think the horse are happy with that. And after that, I needle the horse and perform modifications depending on the assessment, and maybe some stretching also depending on the assessment. I combine, but no electrical devices. More questions, Maria?
How do you know when it's okay to stop needling? Is suddenly lack of tension after needle, or you can't feel the trigger point anymore? Okay, you stop needling. When you are needling, you're going to see if you have detect the trigger point. The local trigger response is very, you can see a big local trigger response. It's very clear, the response. So you have to needle until the local trigger response have disappeared. Okay, and this is the moment why, or if you, for example, if you start to needle and you don't see any local trigger response, okay, you stop needling. Okay. Is suddenly lack of tension after needle? It is true that dry needling is very effective, and after needling, you can feel how the muscle release is very. And in for example, in horses, you can see this response very clearly because the horse has big muscle, big powerful muscle. So when you starting with a lot of tension, for example, in the brachiocephalicus, in the gluteal muscle, and you finish needle, and after you palpate, okay, you feel that there is no so much tension.
No, I was going to say the same, that first you needle until the local twitch response is abolished. So, and if the question is more, if this person is more asking, when do you know you have to stop needling the muscle? First, because you just don't find more taut band, or you just don't feel the trigger point anymore, or the horse is giving a different reaction. Also, because the horse is tired. That, as I said previously, sometimes the horse is tired of needling. So even though you still are palpating more tension or more trigger points, you just cannot keep on going. And also sometimes because the muscle all of a sudden gets released. This happens especially, as Maria said, in gluteus. It's something that you can really feel, that you are palpating and all of a sudden the muscle it starts going like this. You can touch and previously you have touched the gluteal and it's like this, and all of a sudden you palpate it and it gives you a feedback of movement inside the muscle. And that's very interesting, actually, the quick reaction of the muscle.
Which tools do you use next to the needles? Maybe, well, you can, after needling, for example, to finish the treatment, you can do a more relaxing technique. You can combine, okay? It's very, very well accepted in horses, for example. When I usually end the treatment with dry needling, I do some massage in general, and the horse became very relaxed, and it's very nice to see this attitude in the horse. What we should do if needle break inside muscle? Okay, we have never. It's not a common problem.
I think it will be a big problem. But think that the needle is going through the body of the horse freely, moving freely. I think it will be a big issue, especially because you don't know where the needle is going to go. But still, Agupun needles are made that the whole metal wire just goes and makes, from the same metal wire, it's made the holder of the needle. So it will be very difficult to break. As I said before in the presentation, or I think answering the questions, I don't remember, I hold the needle in between the holder of the needle and the needle you may get in. So I reduce the possibility, the hypothetical possibility of the needle to get broken, because I am holding it from the middle. So there is at least 1 centimeter of the proper needle that is not getting inside the muscle. So it's just to reduce the chance. Still, with Agupun needles, we are very confident.
Some cheap Chinese needles have a lot of nickel, and those needles tend to break very quickly, especially in horses with thick fascia. So as you said, there's no point in buying those really cheap needles, because the Acupunct needles, which is a brand from Barcelona, the Acupunct needles are designed for dry needling, and they cannot break. I have never seen an Acupunct needle break. They're made to not break. So that's what I tried to say before, and the sound was very poorly.
Okay.
But what I would say, I think you've gone through most of the questions. And if the questions are not answered, we'll answer them later via email. That is fine. We have a collection of all the questions. So if there are any questions that did not get answered yet, we can answer them after in the next couple of days.
All right.
Okay. Okay.
I think we can conclude the webinar here, because it's getting late for you guys too. In Spain, it's only 7 o'clock here, but it's a little later where you are.
Yes.
1 o'clock in the morning. Yes. I would like to thank you both very much. And if your question did not get answered, we will address your question in writing via an email just to you. So in a few days, you will receive the recording of this webinar, and as Maria said earlier, the references and the materials itself. So I'm going to hook off, and if you want to talk a little bit about the other webinars you have then in front of you, probably, then you can stop here.
Well, I just wanted to say thank you to the assistants. Thank you for participating. Thank you for listening to us. I hope you've liked the presentation, even though we have had those little voice problems at the beginning. I wanted to say also that we are having more webinars for next week. Every Tuesday, we have had a program of series of webinars that are called Beyond Dry Needling. And let me see in my agenda. All right, on May the 5th, we have contemporary manual therapy. I'm sorry I'm reading it, I just don't know it by heart. Contemporary manual therapy to manage complex cervical spine disorder. This is in humans. It would be interesting. You just have to take a look up to our website because they are very interesting seminars. And well, I mean, this is just something that maybe you like to know. And also Myopain is collecting donations in lieu of cost registration fees. So this is our way of giving back to the population in need during these difficult times. So maybe you would like to make your contributions to this. I mean, it is to benefit the share our strength. So maybe it's interesting for you to make any donations. You can also take a look to the website and see if you are happy with all that.
All this information is in the website of Myopain Seminars. So feel free to check all this information. You will receive by email your certification of your assistance to the webinar, okay? And we are very grateful for your patience and your assistance and your participation. It is very nice to see so many participants from different countries and your interest on equine trigger points, myofascial pain, and dry needling. And okay, if you, as Jan has said, you can send us an email with all the questions that you have. Okay, so thank you very much.
And please keep safe, stay healthy in these strange and difficult times of COVID, and hope as soon as COVID lets us, we will start with our courses around Europe and around the world. So please stay safe, and thank you very much again.
Thank you.